Hi, and welcome to the LeeBella Counseling and Supervision YouTube channel. I'm Scott Spiers, a licensed counselor and clinical supervisor in North Carolina, and this, finally, is Core Function 10. Core Function 10 is referral. And again, it's one of those core functions that I think counselors look at really briefly. They might do a couple of practice exams on it. And then when it comes to the test, they kind of blank. So let's do an in-depth look at Core Function 10 referral and its global criteria. Core Function 10 simply is identifying the needs of a client that cannot be met by the counselor or agency, and assisting the client to utilize the support systems and community resources available. Make note, this is very closely tied to case management, right? So it's an example of where core functions build on each other. First, I think it's helpful to focus on two key verbs, identifying and assisting. We recognize when a client's needs exceed our scope, our skill set, or the agency capacity. Then we actively help the client connect with appropriate supports. This is a lot more than just handing them a phone number. Global criteria 1 is identify needs and/or problems that the agency and or counselor cannot meet. This is about an honest assessment of limitations. You've got limitations in staffing, training, level of care, medical needs, legal issues, housing, psychiatric care, trauma specialization, and a lot more. On exam questions, referral is often triggered when a client's needs clearly exceed the agency's services or the counselor's competence, especially around safety or specialized treatment. Global criteria, too, should have some really familiar verbiage to you. Explain the rationale for the referral to the client. We don't simply say, hey, I'm sending you over here for care. We explain why, how the referral supports their goals and enhances their safety or the quality of their care. In exam scenarios, look for options that include clear, respectful explanation rather than abrupt handoffs. In global criteria 3, we match client needs and or problems to appropriate resources. This utilizes our knowledge of the community and the system of care within the community. We need to consider the level of care that they're in, cultural fit, location, finances, and the clinical needs of the client. IC&RC language such as appropriate, qualified, specialized, or level of care criteria signals good referral practice. And pro tip on this part, remember this is an ASAM placement criteria area. Global criteria 4, adhere to applicable laws, regulations, and agency policies governing procedures related to the protection of the client's confidentiality. Referral never overrides confidentiality. We obtain signed releases of information, disclose the minimum necessary data, and follow HIPAA, 42 CFR, and agency policy. On the exam, incorrect answers usually involve sharing too much information or sharing without proper consent except in emergencies. This is an ethical area, so be sure to keep HIPAA and 42 CFR in mind on any question relating to this on the exam. Then we have global criteria 5. Assist the client in utilizing the support systems and community resources available. This is an active process. You're helping with the first call, you're scheduling, you're arranging transportation, or you're coordinating with the new provider as appropriate. For the IC&RC, referral is more than handing out a list. Look for language on the exam questions that concern assisting, facilitating, and coordinating. Now, there's also a NADAC ethics tie-in on this core function. From an ethical perspective, referral is about honoring the limits of our competence and protecting client welfare. This takes a serious self-assessment on the part of the counselor and ideally collaboratively an in-depth self-assessment with your clinical supervisor. NADAC's Code of Ethics emphasizes that addiction professionals practice within their scope of competence and make referrals when client needs extend beyond their training, agency resources, or their role. View referral as client advocacy, not rejection. Connecting clients with providers and services better equipped to meet specific medical, psychiatric, legal, cultural, or social needs. That's actually a good thing. That's advocating for your client. Always protect confidentiality through signed, time-limited releases and share only the information necessary for the receiving provider to do their job. Avoid self-serving or inappropriate self-referrals, and support client autonomy and choice when presenting referral options. When we match clients to appropriate resources, explain the rationale clearly, and respect their autonomy and privacy throughout the process, we're not just checking off core function number 10. What we're doing is we're living the core functions of our profession. These are our values. So, yeah, referrals pretty easy, but keep in mind there are 5 global criteria, and you really want to approach this on the exam and preferably in your professional life as realizing that some things are beyond our scope. For example, uh, when I'm dealing with clients that have relationship issues with their spouse, sure, on occasion I'll have a family session, but by and large, if they're dealing with really heavy, like marriage issues, relationship issues, trust issues, I generally refer them out to a marriage and family therapist or a social worker better trained in helping their stuff. I've had to learn that the hard way through years of experience. So, referral to me is about humility and it's about understanding. I can't do everything. And in a lot of things, there are people far more qualified than I am to do it. So that's it for Core Function 10 referral. Be sure to like and subscribe. I will have Core Function 11 up soon. If you would like to schedule a one-on-one free consultation on exam prep, be sure to check out the link to my Psychology Today in the description. And if you have any questions, please feel free to ask them in the comments. This is Scott saying, hey, thanks for hanging in all the way through this. And now go do good things. Go study. Go get ready for the sucker. And don't sleep on Core Function 10 referral.